Thank you. Welcome everybody to the Thurston County Board of Health meeting for August. It's August 13th, a Tuesday. We're getting started just a little bit later than usual, accommodating another meeting that butted up against ours. I'd like to call this meeting to order at 3:56. And I would entertain a motion to approve our agenda.
I would move to approve the agenda for August 13th, 2024.
Second.
It's been moved and seconded. Is there any discussion? Hearing none. All those in favor, please say aye.
Aye.
Any nays? Hearing none. We have an agenda. Could I also get a motion on the June 11th meeting minutes?
To approve the June 11th meeting minutes.
Second.
We have a motion and a second to approve the June meeting minutes. Is there any discussion? Hearing none. All those in favor, please say aye.
Aye.
Any opposed? Motion carries. We have June meeting minutes officially on the record. I'd like to point out that one of our members is tuning in remotely. Welcome, Dr. Beth Harvey. We want to go around real quick and do introductions of the folks at the table, just because we have a number of members of the public here. Let's start with Tanzania.
Good evening, everyone, or afternoon, late afternoon. My name is Tanzania Zinzali Marshall, and that's my name. Are we giving
Just
any
Board of Health member.
And welcome, everyone. Thank you all for being here this evening.
Hello, Heidi Knadel, another Board of Health member. Welcome.
Lynn Nelson, Board of Health member.
Wayne Fournier, County Commissioner and Board of Health member.
Carolina Mejia, Board of Health member.
I'm Robin Vasquez. I'm the Board of Health Chair, and I'm on the Lacey City Council.
Gary Edwards, County Commissioner and Board of Health member.
Good afternoon, staff. Leonard Hernandez, County Manager.
Diana Dolmalik, Staff Health Officer. Good afternoon, Jen Freiheit, Interim Director.
Hi, Jacqueline Gilly, Clerk of the Board.
And we've got folks online. I mentioned Dr. Beth Harvey. Dr. Harvey, do you want to say hello?
Hi, everybody. Hope everyone's doing well. Beth Harvey, Board of Health member.
Thank you. And Commissioner Menser, you want to greet the gathered populace?
Hi, everybody. Commissioner Menser, Board of Health member.
Welcome. All right, we've got a pretty packed agenda, so let's jump into our first proclamation. We have a proclamation on National Immunization Awareness Month. Let's read the proclamation first, and then we can go into our proclamation. Why don't we start on this side of the table for our first proclamation? Do you have it?
I do not.
All right, well then we will start on this side of the table.
Yeah, sure.
So one of those, there's a pile of packets right there.
One of the packets.
Wait for it.
How about, where's it at in the packet?
Page
Maybe I
34.
passed it up. Got it, right here.
The minutes.
We only have about 100 pages in our packet today, so.
Okay, we're gonna do immunization, right?
Yes.
Immunization Awareness Month, the Thurston County Proclamation of the Board of Health. Whereas Immunization Awareness Month highlights the critical role vaccines play in reducing the spread of many infectious, debilitating, and potentially life-threatening diseases, and
whereas the World Health Organization estimates immunizations prevent between 3.5 to 5 million deaths worldwide every year from diseases such as diphtheria, tetanus, pertussis, influenza, and measles. And
Whereas when people are unvaccinated, outbreaks of diseases like pertussis, whooping cough, and measles can and do return, putting vulnerable people at risk.
Whereas an 84% drop in measles deaths occurred worldwide between the years of 2000 and 2016 as a result of measles vaccine, and a surge of the disease occurred worldwide in 2019 with the highest number of reported cases in 23 years due to unvaccinated persons. And
Whereas the resurgence of vaccine-preventable diseases in regions with declining immunization rates underscores the necessity of maintaining high vaccination coverage. And
Whereas the spread of misinformation regarding the safety of vaccines represents a substantial threat to public health particularly in communities with low vaccination rates, jeopardizing the well-being of vulnerable populations, including infants, young children, seniors, individuals with immunodeficiency disorders, those with weakened or compromised immune systems, and the public at large. And
whereas collaboration among healthcare professionals, schools, community organizations, and public health agencies is vital in promoting vaccine awareness and accessibility to all members of the community. And
I'll go ahead and take the next part. Now therefore be it resolved, the Thurston County Board of Health hereby proclaims August 2024 as Immunization Awareness Month and encourages all community members to recognize the importance of vaccinations for people of all ages in every community across the country, to reflect on the progress of science and medicine in the eradication of contagious disease, and for all residents to do their part to help maintain the health of our community by staying up to date on immunizations. Adopted this 13th day of August 2024 by the Board of Health. Thank you. So I think we may have some guests who are going to come and talk to us. You can just join us here at the front. Semi-round table.
One of our guests was unable to make it today, so I think they got busy at the pharmacy.
Good afternoon, Board of Health members. My name is Erin Berkwood, Disease Control and Prevention Division Director at Public Health and Social Services. I'm accompanied today by our dedicated immunization team members, Wendy Hurst, Keegan Sullivan, and Raphael Avina, and our guest. Immunizations represent one of the most effective strategies for preventing and controlling the spread of diseases within our communities. They are not just essential, but life-saving, safeguarding both individual and public health against serious and potentially fatal illness. Annually, vaccinations save millions of lives worldwide. As we convene today, it is crucial to recognize the significant impact immunizations have on the health of our communities and families. Vaccines not only protect those who receive them, but also help shield individuals who cannot be vaccinated for medical reasons. Public Health and Social Services mission is working together to achieve the highest level of health and well-being for everyone. We are dedicated to preventing the spread of diseases, and immunizations are a vital element of this mission. Through collaboration with healthcare providers, educational institutions, and community organizations, we strive to ensure that everyone has access to life-saving vaccines. This month, we take the opportunity to acknowledge and celebrate the importance of immunizations. I encourage each of you to participate in raising awareness about the essential role of vaccines in safeguarding our health. It is our shared responsibility to educate ourselves and others on the advantages of immunizations and to advocate for timely vaccinations. In closing, I would like to extend my sincere gratitude to the Board of Health for proclaiming August as Immunization Awareness Month, and for your ongoing support in our efforts to promote community health as we work collaboratively toward a healthier and disease-free community. Thank you again, and Wendy and Keegan will now introduce our community guests who are here to receive this proclamation. Keegan?
Hi, Keegan Sullivan, staff, Public Health and Social Services, Testing and Immunizations. Today I have Jody Stoltz here from the Tenino Community Service Center and Food Bank Plus, and she's going to be who I am nominating as our sort of local vaccine champion, not quite a state level, but one of our local vaccine champions. Her efforts in Tenino and the Bucota area to serve the underserved, to ensure vaccine uptake and availability, especially in her seniors that she supports, is just astounding. She is a force of nature, and over the course of especially during the response, but in the recovery period as well, she has contributed to, I think, 30 plus vaccine clinics, and as well as being a host site for our testing kiosk that we're able to get installed down there in Tenino. So I just wanted to sort of raise our recognition for Jody Stoltz and the Service Center.
Wendy, I know Sunil couldn't make it. Do you want to speak about Sunil?
Absolutely. So Wendy Hurst, immunization coordinator, staff, I guess is what I'm supposed to say. We all know that pharmacists and pharmacy is one of the most respected professions in healthcare. And Sunil and his team at Hawks Prairie Pharmacy have certainly gone above and beyond in our community to keep vaccination rates up, go out to local adult family homes and so forth that he doesn't even serve as the pharmacist, and helps them to get vaccines when they need it. Working as a hub for our COVID vaccines in Thurston County, the health department dispersed thousands of vaccines to our local providers as well as pharmacies, and Sunil every 2 weeks was getting pharmacy vaccine delivered from us. So he really looks for ways to work with the community, within the community, and to draw people in, not only to the pharmacy, obviously, but to do outreach and to continue to work on ways of making vaccines and so forth available to our community members.
In their absence, let's give them a round of applause. That's amazing. Well, at this point, we could step aside and take a photo with our guest who's here today, our guests.
Sure.
Let's go over there.
Do I have to sit in the back?
Yeah.
Oh, yeah. If you guys don't mind, could we go outside? Because there's quite a few chairs back here, quite a few people, so we could go in front of these windows and take a photo. You know when tech happens and like everyone's watching you type?
You did a good job.
Oh, I appreciate it, Leonard.
Like a late start to a meeting, different things aren't set up right.
Mm-hmm.
Thank
Yeah.
you for working.
How are you doing?
Good, thanks.
Jacqueline.
Jacqueline.
Yes.
I tried to email you, but for some reason.
All right, thank you for those of you who are online for your patience as we stepped out to take a quick photo. We're all coming back in. Go, okay. We have one more proclamation that we wanted to share with everyone today. And for this one, if our two members on the Zoom call, actually now we have 3 members on the Zoom call. Welcome, Perla. How about we start the reading of the Breastfeeding Awareness Proclamation with the folks online. I'll say Dr. Harvey first, then Commissioner Menser, then Perla, and then we'll jump to Tanzania.
I'm not in a position to do that, Madam Chair, so if you could skip me.
Oh, my apologies.
Yeah, I can't do it either. I'm so sorry.
Okay, well, we will just keep it with the folks here in the room and you all can be along for the ride. Okay.
Literally.
Yes.
Proclamation Breastfeeding Awareness Month. Whereas breastfeeding and chest feeding provide a safe and reliable and renewable food source especially critical during natural disasters or emergency situations, and
Whereas the act of breastfeeding builds a strong emotional connection between the mother and infant, and
Whereas breastfeeding can lower maternal risk of heart disease, type 2 diabetes, and certain breast and ovarian cancers, as well as lower an infant's risk of ear infection, asthma, respiratory infections, childhood obesity, type 2 diabetes, eczema, childhood leukemia, and SIDS, sudden infant death syndrome. And
Whereas all major medical authorities recommend that mothers breastfeed exclusively for 6 months and continue breastfeeding for at least the first year of a child's life, yet breastfeeding rates continue to fall short of the nation's healthy people objectives, with 60% of mothers stopping breastfeeding sooner than planned. And
Whereas employers that provide workplace lactation support experience an impressive return on investment, including lower healthcare costs, absenteeism, and turnover rates, and improved morale, job satisfaction, and productivity. And
Whereas there are long-standing policy gaps and underfunding of public health initiatives that address the needs of lactating parents and the providers that serve them, which unduly impact Black, Indigenous, and people of color, or BIPOC populations, resulting in reduced breastfeeding rates and an associated increase in risk for a variety of negative health outcomes. And
whereas the goal of our county government is to improve the county's health by working collaboratively to protect, promote, and support breastfeeding. And
now therefore be it resolved, the Thurston County Board of Health hereby proclaims August 2024 as Breastfeeding Awareness Month in Thurston County, and encourages all community members to recognize the disparities of chest feeding and to promote breastfeeding and services that ensure all pregnant and postpartum women receive equitable care and know the benefits of breastfeeding. Adopted this 13th day of August, 2024. Your Board of Health.
thank you.
Oh, was I, did I?
No,
No,
that was great. I think now we also have another set of guests that are going to come up and join us. Can we welcome Sheila Waterstrat, Ashley Reynolds, and Gretchen Thaler? There's Family Partnership representing.
Good afternoon, Board of Health members. My name is Gretchen Thaler. I'm the Division Director for Community Wellness at Public Health and Social Services. And I am here today to introduce Ashley Reynolds and Sheila Waterstrat. I'd like to thank the board for recognizing Breastfeeding Awareness Month. As we know, and they will tell you more, breastfeeding is such an important part of our children's health and our health throughout our lifespan. So I'm excited for them to be able to jump in and share some great information. So pass it over to you.
Thanks. My name is Ashley Reynolds. I'm a registered nurse, an international board certified lactation consultant. Sheila is also an IPCLC and an RN with me. We are both home visitors with the Nurse Family Partnership. We work within Thurston County's Maternal Child Health Division. We're here today to promote breastfeeding as it's World Breastfeeding Month. We're here to inform, anchor, engage, and galvanize our community to promote breast, chest, and infant feeding of human milk. Breastfeeding and human milk are the normative standards for infant feeding and nutrition. The short and long-term medical and neurodevelopmental advantages of breastfeeding make breastfeeding or the provision of human milk a public health imperative. Breastfeeding is an investment in health, not just a lifestyle decision. WABA is the World Alliance for Breastfeeding Action, and their campaign for World Breastfeeding Month this year is Closing the Gap, so that the most vulnerable in our community can access infant feeding and lactation support in the same ways that the most affluent in our community can. This year's campaign also has a specific focus on the importance of accessing breastfeeding support during times of crisis and emergencies around the world. If you could go to the next slide, please. Thank you. I don't need to beleaguer you with data about the benefits of breastfeeding. I would literally be here all day. We know definitively that human milk is best for human babies and has proven long-term health benefits for infants, for children, and for parents, some of which are listed here. You can go to the next slide, please. Aside from individual benefits for parent and child, breastfeeding has many community benefits as well. It's convenient, it reduces short and long-term healthcare costs for all involved parties, it's environmentally friendly, and decreases energy demands for the production, transport, and preparation of infant formula. We know that during emergencies, the safest food for a baby is its mother's own milk. Next slide, please. Every 2 to 3 years, the CDC releases a report card on breastfeeding in the United States. This data here is from 2019, and it shows us a downward trend in offering human milk in any form in the first year of life, with exclusive human milk feeding at less than 25% in 6 months, which is like way below the recommended amount that we want. This steady decrease indicates that barriers persist in accessing feeding and lactation support, especially for racial and ethnic minorities. We know that disparities exist in our nation, our state, our county, and our city, especially among less affluent and non-majority culture families. Low-income and young parents are the least likely to ever breastfeed, and this is a large percentage of our clients within our family partnership. These families are the most likely to benefit from the many, many good things that human milk does for our bodies, but often face the most difficulties in accessing support. If you're able to go to the next slide, please. In Thurston County, one of the ways that we help low-income and young parents to meet their feeding goals is the Nurse Family Partnership. Research on NFP has found that parents who participate in this program are 21% more likely to be breastfeeding at all at 6 months of age when compared to other parents in similar reference groups. A specific component of the Nurse Family Partnership is the home visit with a trusted nurse who has an established relationship with these families, who truly understands their heart's desire. Families receive support and education in the hospital, but then they come home and they're overwhelmed with their new baby. Home visitors with NFP are just a phone call away, and we can offer support to those families exactly where they are. Next slide, please. Our programs here at Maternal Child Health allow families to access community resources, provide them with encouragement, and educate them on policies and support in places where they live, work, and play. It's imperative that we continue to implement and support policies that protect this critical time in human development for the benefit of society as a whole. Next one, thank you. Here's just a few of the resources we have available in Thurston County. Besides private practice resources, the county specifically has a drop-in lactation support group supported by our foundational public health funds. Family Support Center has a virtual feeding support group. Other resources we have recently created are the LIFT website, which stands for Lactation and Infant Feeding in Thurston County. It's an accessible hub of information and community resources for both providers and families around infant feeding and lactation. We recently helped to manage the Mom Spot at the Thurston County Fair, and we're developing an infant feeding and emergencies toolkit for Thurston County. Breastfeeding and lactation are a universally shared human experience. As our board, you can best support our efforts as public health workers and lactation professionals by continuing to advocate for policies that promote and protect human milk feeding and lactation in places where people work, play, and gather. You can support our efforts through the Maternal Child Health Division, through continued funding, and you can support our community connection efforts through promotion and advocacy for our programs and services. Thank you very much.
Thank you. I feel like it's important to mention that even though breastfeeding is a very natural thing, it isn't easy. It's not always easy for people. It's not always easy to figure out, and people don't have to figure it out on their own, thanks to these services.
Forgive my ignorance, but what is chest feeding?
That's a great question. So chest feeding is an inclusive term for breastfeeding for people who are non-binary or who don't identify as female. So some parents who experience gender dysphoria in some way prefer to use the term chest feeding so that it's a little bit less sexualized for them.
Thank you.
It's kind of a newer term, and you're like, okay, what is chest feeding? It's breastfeeding in 2024.
Not a question, really just,
That was my question too, so.
not a question for me, just a thank you for all the work that you do. I remember as a first-time mom, and breastfeeding is not as easy as, you know, it's made to sound. It's not something where the baby just latches on. a lot of work that goes into it and patience. And so the support that NFP is able to offer the families, 6 months after, I think that's pretty incredible. So just thank you so much for that work that you're doing.
Thank you.
Well, if it's all right with everyone, we'll adjourn for a quick vote, and then we'll come back and we'll move on to the next item on the agenda. Thank you for being here.
Back outside, Madam Chair.
Let's do it.
Okay, to the stairs.
Those of you that are online, we will be back with you in just a minute. Thank you. All right, we're coming back. Next item on the agenda is opportunity for the public to address the board. I'll read a quick set of guidelines for public comments. So the Board of Thurston County Public Health welcomes comments from the public at all meetings. However, there are some guidelines governing such comments to ensure they're appropriate and don't take advantage of the fact that most meetings are televised. So our general speaking guidelines, please introduce yourself, include the address where you reside in the county.
Unmuted.
Yeah, it looks like it.
Yeah, maybe.
Folks online, are you able to hear me now?
I can hear you now.
Thank you. I'm going to read a little bit of that again because we were muted. So our general speaking guidelines for public comment, please introduce yourself, including the address where you reside in the county. Please address the board, not the audience or staff. Please silence your cell phones. The board does not respond to public comments, but on an as-needed basis, the county manager may follow up with specific items. Speakers are limited to a total of 3 minutes to address the board. Meeting attendees cannot donate their speaking time to another person. The board reserves the right to restrict a person's opportunity to address the meeting for good cause. No comments that are lewd or offensive, inflammatory, hateful, defamatory, or discriminatory in nature. Please be respectful. No outbursts of any kind. No comments that are commercial in nature, such as promotion for a for-profit business. All materials provided to the county can be considered a public record, subject to public release upon request pursuant to the Public Records Act, Chapter 4256 RCW. Remarks about pending land use permits or similar matters that could eventually come before the board on appeal should be avoided. Thank you for all of that. And we also do not permit electioneering. So I understand we have someone wanting to give us public comment today, so please come to the front. Welcome.
Hi,
My name's John Pettit. I live on Rich Road, southeast. There's actually a couple topics which I wanted to address. One of them has to do with something, as a Board of Health, you have certain abilities and privileges to be able to take. One of those privileges might be to create an emergency ordinance to deal with some of the homeless situation. And one of those particular items has to do with allowing people to let an RV stay at their location, at their home or such, by connecting into the proper water and septic system that exists. That would eliminate a whole lot of places from being illegal. Technically, I have somebody living illegally on my property, but they're hooked up properly and taken care of. But it's the right thing to do. I think the Board of Health has the opportunity to do the right thing here and help promote an emergency ordinance of some type. So moving on, since I probably have only another minute or less, I had sent in a particular document, and sparing myself from being labeled only the bean counter, one of the things that causes people not to go through permitting process is expense. And if you receive my little sheet, you can see that an actual hard expense for the county to be processing things amounted to somewhere around $87 an hour worth of time. We measure everything in hour units, and we're charging $260. And part of your Board of Health bylaws actually indicates on there, according to the RCW, which was posted on here also, that fees for services shall not exceed the actual cost of providing any such fees. So I think it's recommended that you adjust the fees downwards to actual hard costs that the county endures. And then maybe more people will actually be able to afford to do it and help each other. That's it. Thank you.
Thank you. Are there any other members of the public wishing to address the board? Anybody online? Okay. Public comment is wrapped up. We'll proceed to the next item on our agenda. We have a pesticide prescriptions approval process. Welcoming to the front Kimberly Graham, Tim Wilson, Mark Emrich, Mike Murphy. The whole team. Ella? Pulling up some slides.
Sorry, I'm Kimberly Graham. I'm with the Solid and Hazardous Waste Team in Environmental Health. And I will kick off the presentation with the Integrated Pest Management Plan, what that is, what our county plan looks like, and then the Noxious Weed folks will take over and talk about that part of it. And then finally, we'll end with our Pesticide Committee Chair here. So let you guys introduce yourselves.
I'm Mark Emmerich. I'm the chair of the Pesticide Management Board.
Good afternoon, Board of Health members. I'm Tim Wilson. I'm the Water Resources Division Manager with Public Works. Water Resources oversees the stormwater utility, water and sewer utilities, and the noxious weed program.
And I'm Mike Murphy, Noxious Weed Program Manager for Public Works.
Welcome.
So public concerns over the hazards associated with pesticide use started gaining traction in the 60s and escalated in the decades following, which in 1989 led to the county's implementation of what is known as the Integrated Pest Management Plan policy. The policy, which applies to county property and property managed by the county or its contractors, aims to lead by example by implementing pest and vegetation management programs that ultimately minimize pesticide use. Integrated pest management is a pest and vegetation control approach that prioritizes non-chemical methods to prevent significant damage, annoyance, or safety hazards. If chemicals are required, the least toxic options will be used, and only when other methods are ineffective or impractical. County departments responsible for managing pests or vegetation, such as noxious weeds, are required to create a written IPM program, which must initially be approved by the Board of County Commissioners and reviewed annually by the Pest and Vegetation Advisory Committee. These written programs include a description of responsibilities and properties maintained, operational guidelines and standards, IPM prescriptions and plans, and a public notification process for pesticide applications, as well as record-keeping procedures.
Okay, I will take over the next few slides, and as Kimberly mentioned, you know, kind of the reason we are here is to present a new noxious weed prescription. So I want to talk a little bit about the relationship of the state mandated noxious weed program and the responsibilities of that and how it relates to the IPM policy. So within the IPM policy, section 4, it states program policy statements for implementing the IPM policy will include at a minimum a recognition of the responsibility for the control of noxious weeds and the need to coordinate with the Noxious Weed Control Board. So we're a little bit unique from other county programs. If you think about this building and managing vegetation or pests within or surrounding this, there would also need to be a prescription for that. But where we differ managing the noxious weed program is we are operating under RCW 1710, which we'll talk about here in a little bit, that mandates that counties have a weed board. All of the counties in the state, -1 at this time, have a active noxious weed board. And as part of that program, we are required to both implore that private property owners and public agencies manage certain classifications of noxious weeds within their program or within their property when they're discovered. But we also have that same responsibility for our right-of-ways and for the properties that we manage. We try to lead by example in doing that. So within the policy, perfect, thank you. Within the policy, it speaks to both injury and action levels. An injury level refers to the point in the growth of the pest or vegetation problem at which it will cause some unacceptable level of safety, recreational, public health, ecosystem, aesthetic, or economic injury. And it defines action level as the level at which action must be taken to prevent a pest population or vegetation problem at a specific site from reaching the injury level. The policy talks about both of those as triggers for being able to move forward with controlling a pest using a pesticide. So for most of the listed noxious weeds, the presence of the species is equal to both the injury and action levels. So the mere presence, if we find a new listed noxious weed out in the county somewhere, we are required by law at that point to intervene and control that noxious weed. Next slide, please. As I mentioned, just a very quick overview of Washington State noxious weed laws. These are some of the oldest and well-established statutes in the state. Many of these predate statehood. They were adopted initially to implore the county to manage their noxious weeds along their right-of-ways to protect farmers and property owners. RCW 1710 establishes state and county weed boards to limit economic loss and adverse effects to Washington's agriculture, natural and human resources due to the presence and spread of noxious weeds. And again, the statute goes on to mandate effective noxious weed control and eradication. And then WAC 161750 establishes the noxious weed list. That weed list is established by the State Noxious Weed Control Board each year. That is then passed to the local jurisdictions who have 90 days to adopt their own weed list. the three classes of noxious weeds, not that it really matters here, but just for awareness, Class A, Class B, and Class C noxious weeds all have different levels of response to their presence. Class A and Class B designates are those weeds that, if we find them, we are mandated to control them within the season.
Can you give us an example? What's Himalayan blackberry?
A non-listed Class C. Usually when they are widespread within the county, they're beyond really being feasible to control.
Scotch broom, blackberry
It
vines,
would
those things that we
bankrupt
can't.
us.
Yeah,
Exactly.
yeah.
We are, a lot of the weeds that you will find on the Class A weed list, the
Tansy.
state-approved weed list, are not present here.
Yet.
And, no, yes, so we monitor for those, and when we discover them, we are mandated to get those right away, because they're invasive, they cause a lot of economic damage or whatever. I would add that all of these weeds, before they go onto both the state list and once they're on the county list, go through a risk assessment that factor in a lot of different factors. It's not just a group of people picking a weed, we don't like it, it's on there. It's
I
a
received
process.
a complaint from a resident regarding tansy on county property.
Yeah.
And the allegation was made that we're not taking care of tansy on our own property and it's spreading it to others who we then enforce rules on, and we're not taking care of our own.
What I would say to that is many of those complaints are often St. John's wort or other plants that are lookalikes. They are.
This is coming from somebody that knows the
They
difference.
can be tansy. We have, our team, first and foremost, when they're out on the roads, stop and pull. They monitor the right-of-ways, kind of that lead by example. So 1,000 miles of right-of-way, it's hard to be everywhere, you know, in the short window that this blooms. But I've managed these programs in other counties, and I'm very, very proud of how responsive we are on our county right-of-ways. But if there is anytime there is a complaint or a concern like that, please let us know, let Mike know, and we'll be responsive.
Yes, thank you.
So noxious weed prescriptions, next slide, please. There are about 40 of these currently that the Board of Health has approved. Our noxious weed list, as I mentioned, it's fluid, it changes from year to year. Sometimes weeds come off if they've been eliminated or they're no longer a concern, or they're coming on. Each time we have a noxious weed that we find in the county, we go through this process with both PIVMAC and the Board of Health to get a prescription approved. I would add it's a collaborative process with the Pest and Vegetation Management Advisory Committee, in that we typically work back and forth with them and public health employees to make sure that they're comfortable with it as professionals in this arena, and it's user-friendly and that it's understandable. So it's a collaborative process. Usually when a noxious weed is discovered, again, we will develop a prescription, run it through the process. And I would also add that this is additive to, it's an extra layer of safety regarding pesticide management. Because if, you know, to those of you who have experience with herbicides or pesticides, in order to be used in the state, they're registered by EPA, they're approved by Department of Ecology to be able to be used per label in the state. And then any applications are then governed by the Washington State Department of Agriculture, who require that all of our staff be licensed and trained to do that work. So this is adding an extra level, which is great. So a little bit about the prescription that we are asking you to support tonight. Next slide, please, is for a noxious weed floating primrose willow. So this is a Class A noxious weed, eradication required. Class A is that highest level of classification for noxious weeds. This grows aggressively along shorelines of lakes, ponds, and other freshwater areas, traps sediments in waterways, outcompetes native plants, and impacts wildlife habitat and food supply. And this plant, like a lot of aquatic weeds, reproduces through fragmentation. So if you go in and try to manage this by hand, pull it up, you break a fragment off, wherever that lands, it's going to keep growing. So it's difficult and it's invasive. Next slide. So floating primrose was discovered along the Chambers Lake shoreline in Thurston County last summer, summer of 2023. It's one of only 2 reported sites in the state. So this is one of those examples where it was on the list, but it wasn't here. Boom, it was discovered. Staff went out and mapped it and initiated a control program as soon as possible. Manual control was attempted last year. You can see staff out there trying to hand pull, bag this stuff, get it out of there. It is not successful because it spreads through fragmentation. So we are recommending the use of imazapyr, which is the least toxic herbicide that is efficacious for this weed. Imazapyr, you're probably very aware, but you'll see imazapyr in a lot of the approved prescriptions that you've already approved. It's one of 5 herbicides for most of these noxious weeds that you will see repetitively on the prescriptions. And with that, I will hand it over to Mark.
So basically, for kind of a little bit of history, the Pesticide and Vegetation Management Advisory Committee basically is a buffer, for lack of a better term. As these prescriptions come down and they get ready to be put basically in the hands of people in the county as well as staff, we want to make sure that they're being done as well as possible as far as what it's targeting, how we're targeting it, and what's the easiest way to do things. So we try to do manual methods first. We have other controls that we try to put in first, and then we try to put in the best targeted pesticide, herbicide, fungicide, whatever it be, at the end as we have to do it this way. There are some, like this particular plant, that does not have a manual control to it. If we go in and we pull it, we're going to end up with 3 times as many as we started. So we know we're kind of behind the 8 ball with this particular one. We're exceptionally, because of my committee, there's 12 of us, and we have environmental backgrounds, agricultural backgrounds. So we have a lot of people that not only are players in the game and probably at some point are going to have to take something off our own properties, but we also have appliers who also sit on the board as well. And they also give their input to, yes, this is probably the safest product we can use to put out there. And especially in water column, we are really, really scared about putting anything in a water column. So when it comes to floating weeds, they get extra attention from my committee. So we make the evaluations, and the evaluations basically, we've moved on. Okay, so basically the evaluations are on the sheet that you saw earlier that is our prescription form. And I would say that it is the best of both worlds to move with this and consider moving on it quickly, because we're coming up on when it needs to be applied. And so we're coming up against some time constraints. And those are things that we try as the board to meet as early as possible when the weed list first comes out, so that we're not holding up the other departments by saying, it's going to take us a month to put a meeting together, you guys are going to have to hold up. So they can use the methods that they can use as soon as possible when it's applicable. And that's timing in weed management, and a lot of times is really, really critical to get them in a particular space in time where they're going to die off the quickest, not be able to reproduce. You're going to break that cycle where you're not going to end up having them year after year after year. So that finishes my part of the presentation. I would ask the board for another moment. I have been with the board now 11 years. I've been the chair of the board the past 10. I was brought on originally because I was president of the Washington State Beekeepers at the time, and I was doing a lot of things in pesticide management to make sure that our pollinators were not being affected. And so I had many different reports that I basically digest on a regular basis. Through the years, I've really enjoyed my work with the board, but this will be my last year. I haven't been heavily into the pesticide side of things for about 3 years, and that pretty much makes me a dinosaur. So to lead a group where I'm not on the cutting edge any longer is doing a disservice to the group. So I'm planning on stepping down. I've been asked by Kimberly if I would stay on till the end of the year because she's relatively new where she is and kind of help sculpt what we've already done so we don't have to reinvent the wheel again. I also would like to remind you folks that we do have vacancies, and so far you've given me wonderful, wonderful people to work with, and I thank you for that because you could tell that there was some forethought in the candidates that you've given me through the years. So I ask you to take a look. I'll have Kim forward you the vacancies and where they are, whether they're agricultural, industrial, wherever in our program. To, if you know people that you could plug into those, that would be wonderful to keep this going. But this group needs your support, and I thank you very much for your time.
Thank you.
Sure. By any chance, could you elaborate a little bit on chemicals that we use that I think they're, all of the chemicals we use are used by the state of Washington, is that right?
That is correct. That is correct. We can't use anything that's not been cleared by the state, and the county goes even farther. So we ban chemicals in the county that the state says it's okay to use. So we actually even have another layer of, we feel that some of the chemicals, even though the state of Washington said are okay, as far as not being specific to a particular problem, just have a kill rate that's farther out than what we're comfortable with. And so we actually even are a little bit more stingy when it comes to that type of thing.
We're more careful than the state of Washington in what we release and what we apply.
Well, thank you for your many years of service. Thank you
so
very
much.
Thank you. I believe we're being asked to take action on this today. Is that correct?
Yes, please.
So I would move to review and approve the pesticide prescriptions.
Second.
There's a motion and a second. Is there any discussion or questions about this?
I actually did have questions. You covered most of it, so I seriously have some questions, but now I only have two.
Score.
I was curious about the specific brand of the imazapyr that you use. You know what I mean? Like the label or whatnot. Like there's a couple different popular ones, like Chopper or Stalker or whatever.
It's correct. I'm going to let these gentlemen answer that one actually, because we don't try to actually give one credence over another. Since
Okay.
the base chemicals are all kind of the same.
Okay.
So we're not telling you, I happen to have stock in this company, and this is a really good one.
Right.
So we try to stay away from that. But you
Use the
gentlemen,
generic
please
version of it.
chime in.
We tend to use Polaris, which is an aquatically labeled version of imazapyr. And we will use that in both aquatic settings and terrestrial settings, so
Is that liquid or granular?
liquid.
Okay, awesome. Thank you.
Yeah, and happy to get you a label or whatever information.
I was just a little curious because there are the little differences, the chemical differences that you were talking about may make a difference in the animals that it does affect when we do use it. And that was really my only thing. Thank you.
Question? No? All right, seeing no further questions or comments, there's a motion and a second. All those in favor of approving this request, please say aye.
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 Thank you for people on the line. Any opposed? All right, this prescription has been approved. Thank you very much. Thank you. All right, our next item on the agenda, we have the environmental health fee schedule. Season Long and Jesse Smith. Join us at the front.
Good afternoon. I'm Susan Long, the Environmental Division Director of Public Health and Social Services. Today, we are proposing some changes to some fees in our food, pool, school, and water lab programs. We're primarily focusing on these programs because of Jesse Smith, who's our new program manager, and he came to us 6 months ago and has been doing a bunch of process improvements since that time. So he is really the architect of this summary and will be presenting a bulk of this information. I just wanted to let the board know that we are conducting a fee study in 2025 looking at all of our division fees. So land use, water, et cetera. So we'll also be looking at the hourly rate in that evaluation. So I'll be coming back to you probably next year with some recommendations across the board. So unless anyone has any questions for me, I'll hand it over to Jesse.
Hi, as she said, Jesse Smith, the Environmental Health Program Manager. Yeah, so we did a bunch of program evaluation, process evaluation over the last 6 months, and so most of these proposals are geared towards those. There was a couple of handouts in the packets of the fee schedule itself with the changes and the summary. There's actually like about 20 different proposed fee changes, so I figure we can go through them one by one, and if you have questions after each one, so we don't overwhelm you with just 20, if that works for you. Most of them are revenue neutral. They're not intended to gain or lose. Some of them would have revenue increases and revenue decreases with the proposed changes. So unless there are questions before I get going on them.
I think one question, just to provide a little bit more context. These fees are charged so that our programs are partial fee for service, right? So that we're getting some funding back that goes to fund the provision of the services or fund the staff positions to do the work in the community.
So food and environmental services is pretty much all, I don't think it's 100%, but it's the vast majority is fee for service. So my position is not covered by fees, but generally the rest of the staff's, except when they work in some other programs like lead or vector, there's just no fees associated with those. So those get different funding sources.
Because we do have grants or we have some, general fund money that can provide support for public health staff. But some of the work that we do, we don't have general fund money or grant money to fund those positions. So to be able to provide the services, we have to charge the fees. And so we got to keep reviewing and updating those fees so that they cover the cost of the services.
Right, yeah, food and environmental services, there are very limited grant opportunities, and then general fund money or FPHS type money, those kind of things are way above my pay grade type of thing, I guess I would say. But generally, the goal with these types of programs, we're trying to recover the money from the people who use the services.
Okay.
Madam Chair. You said you had about 14, what did you say?
I don't know the exact number off the top of my head. I think there were about 20 different changes. Some of them were just removing fees that aren't used anymore, but yeah.
It seems like when I was going over this, I saw something like it was going to be like around a 3.5% increase.
So in the fee schedule itself is already built into it that it's up to 3.5% every year. This isn't associated with that. There's in the Board of Health article, there's the annual cost of living or CPI adjustment that goes from 0 to 3.5 based on the CPI. This is separate changes that are mostly unrelated to any kind of revenue capture.
So it's an automatic for those that are up to the 3.5, is that it? And you're gonna go into about 20 different ones?
So the 3.5 is separate, yeah, that's automatic based on whatever the CPI is for that year. These are some of them, a lot of them have no revenue changes. It's just adding fees that aren't properly in there or removing fees that we don't need or changing how we collect the fees to improve our process. But the intent for most of them is not to deal with like percent increases or stuff like that. There are a couple in there that would lead to less revenue and a couple that would lead to more revenue for your consideration. But most of them are neutral as far as that. The 3.5% is just what Thurston County has chosen for their, it's not 3.5%, it's 0 to 3.5% based on CPI. It's just because of inflation the last so many years, it's essentially been 3.5%.
Thank you.
So rather than review all 20 of them, we have the information for these fee changes in our packets. I would perhaps invite any specific questions that members of the board have before we take action on this, just in the interest of time.
I mean, that's fine. I don't have to talk.
I don't want to cut you short, but.
Yeah, no, I wasn't sure how much the board had a chance to review them and everything, so.
Are there any specific questions about these fee adjustment proposals?
Nope. I mean, I can.
Madam Chair, if I could just suggest, there are a few that really stand out, if we can just cover a few of the highlights. That'd be no.
So some of the things that I would say we would like to highlight are some of the customer service related ones. So for temporary food permits, we're proposing to add a medium risk temporary food permit, which essentially would create another category for our temporary vendors. Right now, they only can get low or high, and so there are a lot of people paying more to get high risk permits. So this will provide an option for ones where it's less risky than, say, a normal high risk, and many other counties already do 3 standards, and so it's going to give people who may not have wanted to get
a stair step.
Yeah, so it just provides another option that costs less. It may generate some new revenue because some people who may not have been willing to pay the high risk permit will get a medium risk, and then there are others that are already in high risk now that will be able to get a cheaper one than that. We're proposing a 25% fee adjustment for nonprofits to get temporary permits. We've had requests from nonprofit groups, so giving a little discount, especially in smaller communities where it's not necessarily going to be bring in the amount of revenue that a big event is, and so doing that so they can maybe actually do some fundraising, those kind of things, where they might not have really thought it was worthwhile, and they can have an event with food at it. A lot of the other ones, it's removing, we're adding a recurring temporary permit. It's a type of temporary permit that's not on our fee schedule, but it should be an option, and so it'll give another route for temporary vendors to get permits that may be cheaper than what they would have done in the past. And then the plan review fees, the fees aren't changing as far as how much we've actually changed, but we're going to make the process a little easier. So in the past, we'd charge an hour's worth, we'd do the review, and then we'd bill for everything at the end, which could be 10, 12 months later, and sometimes they're not expecting another bill. So we're going to tell them up front, here's how much you're actually going to owe, and when it comes time to actually get your permit, it'll speed up that process by at least a couple days. Where now, once they're ready to go, they have to wait a couple days to figure out how much they owe and pay the fees and then get their permit. So that's one of the process improvement ones we're trying to work on. We did a study on how much we're actually charging for plan reviews. And so the flat fees we're proposing are exactly the average of what we were charging prior with the hourly rates. So we're trying to get rid of as much hourly rate fees as possible. So it's not gonna have like different fees based on who does the review or stuff like that.
It's a bear to track.
My question in regards to the temporary level permits, and so seeing that medium risk, and so I'm wondering, we went through this process a couple years ago in terms of pop-ups, and so where would they fall into those categories?
So pop-ups are not a temporary permit. They fall under our annual permitting process. So they wouldn't fit into any one of these specifically. Depending on the menu, they would fit into what our mobile food unit permits go as, because they can operate, 365 days a year. And that's either a high-risk, low square footage food establishment or a low-risk, minimal square footage food establishment.
The temp permits are for somebody that goes to a festival and they have like 3 events they're allowed to do a year. Is that?
So they can get individual temporaries for every event they go to, or they can apply for our multiple temporary. Once they've had a couple temporaries and shown they know what they're doing, then that multiple temporary is good for as many events as they can do, as long as it's an event. So those are where the temporary fees would fall in. The street vending is, we treat it as an annual permit because even though they operate from a tent and everything, canopy, once they're approved and everything, they can operate as many days per year as they want, so it's permitted that way. But it's categorized either by low or high for those. But yeah, for the temporaries. It's the multiple though is good for unlimited number of events. Well, 365 events if you can find one every day of the year.
Are there any other questions? I'm hearing none. So this action that the board needs to take is a little different because it has to do with funding. So perhaps Rob wants to mention why this is a little different. I was looking for a citation, but I didn't find it.
I actually forwarded a citation, I think, to Jacqueline earlier. But per RCW, that governs the Board of Health, when they amended state law a few years ago and they expanded the Board of Health, they made a distinction that when it comes to fees or budgetary decisions, that the action by the board has to be done by the elected members of the board and not the board in its entirety. So this being a fee item would fall under that. So only the elected individuals present can vote on this matter.
Yeah, I found it. So in RCW 70-05-030, it talks about in section I, the local, nope, I had it, I lost it. It is listed in the RCW 70-05-030 that talks about local Board of Health, like jurisdiction, and the who's on the Board of Health, and that was the one that was updated a couple of years ago to increase the membership. But it talks in there about how only elected officials can vote on matters related to funding. So, elected officials can take a vote on this one.
Is that county elected officials or is that including the city
It's
officials?
county and city representatives.
We base the membership has to be balanced, so it's electeds versus non-elected, so it includes the city.
Understood.
So with that in mind, the elected officials want to make a motion here.
I see Commissioner Mejia was looking something up. Did we have Do we have a pre-printed motion for this?
I move to approve the environmental health fee schedule as presented.
Second.
There we go.
All right, calling me out like that.
I thought you had vice chair. I apologize, sorry.
She's getting ready. All right, there's a motion and a second. Any final thoughts or questions?
Just from the county manager's perspective, want to commend staff for being proactive and looking at process improvement, looking at updating things that are no longer relevant. I appreciate the forethought rather than waiting for something negative to happen to them. It's a good job.
Well, is that a part of our conversation? Can I say something too?
Sure.
I would like to say that the Economic Development Council would love what you folks are promoting, you know, like the county manager said, kind of streamlining, recognizing, you know, the cost of business, especially startups. It's unbelievably expensive. So thank you very much for digging into this, figuring it all out.
Can I add on to that? And I would highlight the pop-up program, because as that program, it was a rough start, right? And it took a lot of work from environmental health, sitting down with the vendors and kind of coming into a resolution that would work, right? That was, because there were a lot of intricacies that, you know, it was like safety, of course, of people buying the food, but also it's like, how can we not, you know, drown these people in all these different hoops that they had to jump, especially as starting out. And I think it's a huge success when two of our pop-up vendors are now restaurant owners, right? And I think these programs are created for that. And, you know, it goes to show like the economic development and the role that we play into kind of that path. And so it's very exciting. Again, it should be highlighted. All right. There's a motion and a second. Will the elected officials please vote? All those in favor of approving the recommended fee schedule, please say aye.
Aye.
Aye. Any opposed? Any abstentions? All right, the recommended fee schedule has been approved by the elected officials on the Board of Health. All right, thank you. Thanks, everybody.
You can stick around. We're kind of an exciting bunch here.
Thanks for visiting. All right, on to the next agenda item. Board use of electronic signatures. Let's bring this one home.
All right, so at the last Board of Health meeting in June, you all authorized staff to revise the board's bylaws to include the use of electronic signatures. So the change is item 4.7 in the bylaws, and it reads, Board of Health members may elect to use electronic signatures to sign documents such as resolutions, ordinances, proclamations, and other pertinent documents that require the Board of Health members' signatures. Individual Board of Health members must sign a consent form prior to the use of electronic signatures. Board of Health members may designate the clerk of the board to sign on the member's behalf. So we are currently working on the consent form mentioned in that item. There's a team of us, we're wanting to make it more relevant to the Board of Health and the needs of the board, so that's coming.
We get our own specific form. It's very exciting.
So we ask that you approve the use of electronic signatures.
Are we gonna approve that for like today's resolutions? If you look at the list, there's 20 people that are supposed to sign. So that makes it a little easier for you, or do you want us to sign those individually before we leave tonight?
Yes.
You do?
If you can. If you can stay. But there are members virtually that I'll have to get their signatures as well.
I mean, I think I've already signed a permission slip, or maybe it was for the county.
Might have been a county.
Permission slip.
Permission slip.
Well, I mean, we use it already, you know, so I'm just wondering if you need us to stay and sign, or did we already sign something for you folks?
Not a consent form
Oh,
for the
okay.
use of.
So you need a hard signature.
I move to approve electronic signatures, languages, and bylaws.
Second.
Moving
I
things
think we
along.
all vote on this one.
Yes, we all vote on this one. Are there any questions or comments? I want to say thank you to Jacqueline for coming to us with the language ready and like already in our bylaws. I appreciate that. This will make life a little easier for us. Okay. All those in favor of approving the amended bylaws to include electronic signatures language, please say aye.
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 Any opposed?
Aye.
Perla, thank you. Hearing none. The motion passes. Thank you very much. We have amended our bylaws and we look forward to the consent form so that we can start using electronic signatures.
But tonight, we have to use this tonight.
Tonight, we gotta do the
Okay, just checking.
wet signatures. We're still on wet signatures today.
Old
Yeah.
school tonight, okay, good.
We'll be shifting into the future soon.
Feather and an inkwell.
Yeah.
Well, that's what I used to sign.
Send it to folks with a carrier pigeon. Okay. Next item, Board of Health items for future discussion. Informational.
All right, so we have 2 items that we're just gonna speak to provide information, and then we'll have further conversation in the future. So one of them are the subcommittee updates. All the subcommittees had their kickoff meeting. In those meetings, you all identified the roles of the members in each committee, and you also all reviewed the respective objectives that is listed in the strategic plan. The policy subcommittee is focused on public health policy that impacts the county and working with PHSS staff on policy needs. This begins with myself collecting information about policy needs, both internally and externally with partners before the next meeting. And our education and outreach subcommittee is focused on educating community members and partners on public health, the Board of Health, and available programming and services provided by PHSS. There's been many great ideas coming out of that subcommittee, and we're just kind of working through what that will look like. Our data subcommittee is focused on understanding and gathering data in order to educate the community on public health and to support policy development. Our PHSS EPI team will be at the next subcommittee meeting to discuss data and epidemiology as the basis of public health science. And in future months, there'll be more to report.
I look forward to it.
So in your packet, there is also a social connectedness and isolation campaign document. This came out of the conversation at the June meeting where we had some community members come and talk about and request that the board declare loneliness and isolation as a public health crisis. So in your packet, you're gonna find the campaigns that our team put together. They worked really hard, and I'm pretty proud of what they developed. So this is for your review outside of the meeting, and then we'll come to the September meeting for further discussion.
I want to say thank you to the staff that worked on the draft of the social connectedness and prevention and isolation campaign. I was talking, let's see, Commissioner, in just a minute. I was talking to Jen before the meeting, and it's Jen and Dr. A. I don't remember who I talked to. It's been a long day. But talking about the fact that the State Department of Health is also embarking on a bit of a campaign to raise awareness about the epidemic of loneliness and isolation statewide. And so it's timely that we're taking this up as an issue here in Thurston County because we may be able to partner with our statewide colleagues at Department of Health and, you know, work with them on getting out communication, tapping into resources and information that we want to share with our community. So thank you for the work that's gone into this so far. I'm really glad to see that we're going to be able to discuss this at the next meeting. Commissioner.
Thank you. When we bring this up at the next meeting, I think I would also like for the full Board of Health to have like an idea of like all the other emergency proclamations that are being worked on as well, and how much resources have gone into that. Just while I'm not saying yay or nay to this, right? I just think just information, and it's really good to have the full picture. And if we're going to be allocating resources, just this is taking staff resources to compile all this data and bring it in front of the Board of Health. And so just want us to be aware of, like, if we're going to be allocating more resources to this, then it's just gonna have to be a shift and seeing.
Taking away resources from.
Well, not necessarily taking away from, but, you know, there's gonna have to be obviously a stretch. And I just also wanna make the Board of Health aware of all the other campaigns that are currently out there that, you know, staff are working on as well, and the resources that are going into that.
Just for clarity, the proclamations or just declarations from the past?
Declarations.
I think we have the racism as a public health crisis that was declared in 2020. There's also, I think, an opioid declaration. Those, and homelessness. Okay, so I know that there are 3 that have been declared in recent years, and I know that when those were declared, like, activities kicked off around county government and.
They haven't been solved. You know, we received a report from the coroner today that overdose deaths have tripled. Typically, it was around 39 to 40 deaths, and we're up to like 160
this year.
Yeah, on track. That's pretty alarming.
I would say from my perspective, it'd be great to, as a new county manager, just to connect and to look at everything going on in public health. You know, there's a lot right now. What are, you know, the commissioner mentioned about other initiatives, but my perspective would be looking at this initiative to see what can we accomplish. I'm just aware as an organization, as we were talking with the appointed directors earlier today, for those that weren't part of that meeting, we had all our department heads that report directly to the county manager up to the commissioners. There's a lot going on in the organization right now. System implementations, working through our financial system transition. And so just want to make sure that whatever we're able to launch, that we're able to complete it, and we're not just signaling something to the community with not enough follow-up and enough staff gusto. At the same time, looking out for the team that I know as interim director, you and Rob are doing a fantastic job of wading in as a leadership standpoint. It's kind of the situation where lots of good things to do, but what's the most important thing as we want to really position public health and social services for the greatest success in an environment where there's been a lot of transition, a lot of leadership change, and being sensitive to the team to give them time to really absorb those changes, change management, and for their longevity.
So we'll have time on the agenda at next month's meeting to really dig into this and talk more about it. I think it's worthwhile to talk about what we can do without overburdening staff. Partnerships might be a key to covering more ground. All right. Any other comments on that? Okay. Well, our next item on the agenda is just a heads up only. We have, oh wait, I don't have that whole name. Discussion. Open board discussion and information sharing. Skipped right past the open sharing portion of our agenda today. Does anybody have any announcements or information to share?
So we got a report from the coroner earlier, and there was like intriguing data to me, and their report on total deaths in the county from like 2018 to now, it was around, if I recall, it was about 2,500 a year. That was like a static number throughout history.
All deaths.
All deaths, total deaths. But in 21 and 22, it jumped up 600 deaths per year, and then it leveled back down. That's weird. I want to know why. There's got to, like, that's, I'm not a statistician, but that would be something that's statistically significant. And I mean, is that something maybe the data subcommittee could look into and chew on, or is that something the epidemiologist could try? Because that's 600 deaths. Something's weird. Or like maybe the data was differently recorded, but I mean, that's something we can chew on.
We've had the coroner come and give sort of targeted topical presentation before on like the opioid
Yeah,
deaths
yeah.
that were being experienced in the jail, but would it make sense to have him come and just talk?
Well, I asked
about-
him.
Yeah.
And he doesn't, he's like, well, you know, they don't do that research, they just collect the data.
Is there
So,
an increase in population?
I mean, there would be, but why would that drop back down? You know,
And when did it drop back down?
What about COVID?
the answer was no when I asked. I don't know, I mean,
Well,
like,
it's not only
we're, I'd like something more than just anecdote, you know,
A data request has been put into our epidemiology team. More to come.
thank you.
I'll have Jacqueline send out the information that the coroner provided to the board. That way, the Board of Health members have it.
Thank you. Are there any other events we want to lift up? Questions we have?
I actually do have a question around like substance use education and then the distribution of Narcan in schools, in like public schools. I'm wondering if we've heard anything about like how they plan on doing that and what that actually looks like.
So there's a change in the law this year that requires schools now to have Narcan in every building. It used to be just in high schools in large districts.
Yeah.
And so we've been gearing up to do that. The state has some funding to provide that, but the details have not been released about how they're going to do that yet. Although it seems like that money is targeted to put Narcan into the hands of students, not school staff, which is interesting.
Exactly. That is why I'm asking you, because it's the same thing in Seattle and it's
Yeah, and
wild.
Department of Health is working on rules around that piece of it, and they've not been released yet. That's what I know. Yeah, and districts are doing a good job of getting their staff supplies
Okay.
up and running and staff trained and all of that.
It'll be issued to children, like, kind of like school supplies?
Yep.
Well,
Yes, the answer is yes.
that already happens to some degree through treatment centers, and there are licensed treatment centers in schools, so it's not really a new concept, but yes.
There are some licensed treatment centers in schools, not all schools. This is
No,
going to be
of course.
completely new to most schools that are going to be getting a large supply of Narcan and very little education about how to use it or really why. I'm just very curious about the rollout and what that's going to look like in different areas, and it's not a lot of answers in terms of professionally where I work in King County, so I'm curious where we're at with that. A little bit smaller, a little bit more focused maybe.
Katie Strozic, question?
Yep, I was just gonna say, given that the rest of the year, Board of Health are sort of preset with many other items, we don't have substance use coming up in a future month, but we can request a written report to submit, so that you have an answer to that. Thank you.
Seems like it would be intended to be a beneficial and protective action, but without education, what's it gonna look like?
Yeah.
Is there gonna be any consistency across the districts? It's a good question. All right, any other items for the body? Hearing none, I'm gonna proceed because we're kind of close to the end of our meeting. The next item on the agenda is heads up only. We have the health officer and interim director's report, and that was included in your packet. Normally, we would ask for a report out, but we had a really tight agenda today, so they gave us everything that they have in writing. So please take a look at that. I don't know if there's any questions about the report that was provided. Seeing a lot of shaking heads. Folks online, any questions or comments on the provided officer report? Officer report and interim director report? Okay, hearing none, I'm moving on to the next item on the agenda. Oh, you have one? You had a face like maybe you had a question?
No, I'm so sorry.
It's okay.
I was curious about the childhood immunization clinics. It's like the no cost, and it says community activities. Are these going to be regular things, or is it just kind of that time of year and we're providing those services to community?
As far as the childhood immunization clinics?
Like, are those going to be regular things that are happening at these places, or is
They
it just
have been
gonna be-
regular every year back-to-school immunization clinics.
Okay.
However, we are reassessing how we can reach more of the unvaccinated population and where we might provide those resources in the future.
Okay.
But it is something that, yes, will continue.
Is there any school-based, clinics in Thurston County? I actually don't know that.
Not in Thurston County.
Okay, yeah, all right.
Lynn's our K through 12 resource. She works for the education, ESD? What's
ESD,
Educational.
Plans on having school-based
Not
clinics?
that I'm aware of in Thurston County. There are 2 in Grace Harbor County, and that's all there are in our region at this point.
Thank you.
We engaged with the Olympia School District last year because there was interest in there, and I think it's a school, more of a school district initiative to really want to do this, and then it came to the resources, and the school district just kind of pulled back away from that conversation. But in conversations with our previous director, right, it was when I was talking about, well, you know, I would want to see something like that in more of our rural communities where the need is more prevalent, right? Rather than, you know, I know some of our bigger school districts have a little bit more resources, they're a little bit closer, but our rural school districts sometimes don't. And so, but just, I think budgetary situations kind of dropped the conversation, and it's something I know I've talked to Lynn about, as well as Dr. Harvey, and because they're more knowledgeable about the Grace Harbor one and how that works. So
Sustainability is always the issue.
Yeah.
You know.
Are there the resources to keep it going? Thurston County has one of the lower immunization rates in Washington, right? And that's what we're trying to fix. All right. Now I'm going to move us on to the last item of the agenda, adjournment. Does anyone want to make a motion that we adjourn?
I'll make that.
Is there a second?
Second.
All those in favor, please say aye.
Aye.
Any opposed?
Aye.
Thank you. We are adjourned. Thank you, everybody. We got through a marathon Board of Health meeting. We will see you next month.